RMC is one of the deadliest kidney cancers, often unnoticed but devastating. It lurks undetected, affecting predominantly young individuals with sickle cell trait. Awareness and early detection are critical. This is a story about resilience, fighting back, and demanding better health care and awareness. It's a call to action to raise our voices and fight for a future without RMC. RMC predominantly affects people of African descent, but can also affect individuals from the Middle East, Latin America, Asia, India, and the Mediterranean. Awareness is crucial. It disproportionately affects those with sickle cell trait, facing systemic healthcare barriers. Lack of research leads to late diagnoses and limited treatment options. Imagine being diagnosed in your prime, dreams overshadowed by uncertainty. A strong support system is essential. Together, we can raise awareness and advocate for better research. RMC is a rare and aggressive form of non-clear cell kidney cancer. The most common symptoms of RMC are blood in the urine, pain in the kidney area, and unexplained weight loss. It develops in the renal medulla, impacting the kidney's vital functions. Early detection is crucial for improving outcomes. Ongoing research aims to find better treatments. Raising awareness and community support are vital. RMC primarily affects adolescents and young males, especially those of African descent with sickle cell trait. This genetic predisposition makes them more susceptible to this aggressive kidney cancer. Raising awareness and providing support is crucial. Understanding the genetic and environmental factors can help develop effective prevention and treatment strategies. Community engagement and education are essential in addressing RMC. The link between sickle cell trait and RMC is critical. Understanding this can improve diagnosis and treatment. Sickle cell trait, common in African descent, increases RMC risk. It's a silent passenger with profound health implications. Sickle-shaped cells cause kidney blockages, leading to chronic damage and inflammation, potentially triggering cancerous cells. More research is needed to understand this complex relationship, considering genetic, environmental, and social factors. Healthcare disparities and underrepresentation in research exacerbate the problem. Inclusive research and equitable healthcare are essential. Public health campaigns and educational initiatives are crucial in raising awareness about the trait and its associated risks. Addressing sickle cell trait can improve outcomes for those affected by RMC. The journey is long, but progress is within reach. The story of sickle cell trait and RMC underscores the need for a holistic approach to medicine, considering all factors. Collaboration across disciplines and communities is essential. Community engagement ensures research is relevant and beneficial. Education and advocacy empower individuals and drive policy changes. Together, we can make a difference in individuals affected by these conditions. One of the most significant challenges with RMC is the late diagnosis, which often leads to dire consequences. Because the symptoms can be vague and mimic other common conditions, it often gets misdiagnosed or diagnosed at a later stage when the cancer has already spread to other parts of the body. Imagine going to the doctor with persistent back pain or blood in your urine, only to be told it's probably a muscle strain or a urinary tract infection, delaying the correct diagnosis. By the time RMC is suspected and confirmed, it's often too late for effective treatment to make a significant difference. This delay in diagnosis has devastating consequences for the patients and their families. It limits treatment options, reduces the chances of survival, and robs young people of their futures and dreams. Early detection is key to improving outcomes for RMC patients, offering them a better chance at life. Despite the overwhelming challenges, individuals battling RMC and their families are not giving up. They are fighting for their lives, for more research, and for better access to effective treatment options. They are raising awareness, sharing their personal stories, and advocating for meaningful change. This fight is about more than just one type of cancer. It's about justice. It's about addressing the systemic inequities in healthcare that have allowed diseases like RMC to disproportionately affect marginalized communities for far too long. We must amplify the voices of those affected by RMC, ensuring they are heard. We must listen to their stories, understand their challenges, and join them in their fight for better healthcare, increased research funding, and ultimately a cure for all. The fight against RMC is inextricably linked to the fight for health equity. People of color often face significant disparities in health care, including unequal access to quality care, lower rates of early detection and diagnosis, and implicit bias within the healthcare system. These disparities contribute to the late diagnoses and poor outcomes often seen in RMC patients. It's unacceptable that someone's race or socioeconomic status can influence their chances of survival. We need to dismantle the systemic barriers that prevent equal access to quality health care. This includes addressing implicit bias in medicine, increasing diversity in clinical trials, and ensuring that everyone has access to affordable, comprehensive health insurance. The fight against RMC is a race against time, a battle we cannot afford to lose. Daily, young people are being diagnosed with this aggressive disease, and their lives are being cut short, leaving families devastated. The urgency for change has never been greater, and the call for action is louder than ever. We need increased funding for research to better understand RMC, develop new treatments, and ultimately find a cure for this deadly disease. We need to raise awareness about this disease within the medical community and the general public so that it can be diagnosed and treated earlier, saving more lives. We need to address the systemic inequities in healthcare that allow diseases like RMC to disproportionately affect marginalized communities, ensuring fair treatment for all. We need to act now, and we need to act together, united in our mission to bring about change. This is a story of hope and advocacy. Join us in this journey of resilience and unity. Together, we can raise awareness and support those affected by RMC. Researchers are unlocking the secrets of RMC, driven by hope. Advocates are fighting for equitable health care for all. The power of community and collective action is undeniable. Stand with us, lend your voice, and be part of the change. Together, we can make a difference. For more information about RMC and SCT, visit our website at chrisjohnsonfoundation.org.